Hello and welcome. You are watching News 9 Live. I am Krishnakumar and we right now are putting the focus on the healthcare space in our build-up to the all-important Budget 2024. We here at News 9 Live are running our pre-budget programming, and in the special series that we're calling Budget 2024, Blueprint for the Big Leap, we are focusing on what is going to be the outcome for the healthcare sector in the upcoming Budget 2024. Will it provide a roadmap and outline the priorities as far as the Indian government is concerned, as far as the healthcare space is concerned? Will government increase the allocation? Will government prioritize public health initiatives? What new schemes and measures are likely to provide a fillip to this sector? Will the government put emphasis and handhold health tech startups? To discuss that and more, joining us on the show today, we have Dr. Navneet Bali, CEO, Clearmedi Healthcare. Thank you, Dr. Navneet, for taking time out to be with us. We have Anurag Yadav, CEO, Gleneagles Healthcare, also being with us. Anurag, thank you so much for taking time out to be with us. I'm going to begin with Dr. Navneet Bali. If I were to ask you a very simple, straightforward question, what are your expectations from Budget 2024 for the healthcare space?
I think as COVID rightly proved that healthcare is something that the country must look at very seriously. And right now we are sitting on the cusp where government is taking huge initiatives in its flagship schemes like Ayushman Bharat. There are around 60 to 80 crore Indians, especially in the missing middle part and also in the unorganized sector, who just do not have even today access to good healthcare. My expectation is that if something is done to these unorganized sector and also people who are completely bereft of any healthcare, I think that will be one of the greatest steps that the government can take. In addition to that, primary healthcare and prevention, 140 crore Indians cannot be treated by free healthcare at all. So if that is an initiative which the government can push, I think that will be wonderful for the healthcare sector.
Right. Let me begin with the even most fundamental question. Anurag Yadav, in terms of allocation for the healthcare sector, if I were to ask you, are you expecting an increased allocation in this first budget of Modi 3.0 government?
Yeah, Krishna, thank you. First of all, thanks a lot for having me on the show. I think we should expect an increased investment in healthcare infrastructure, right? That's a requirement of the country. If India has to become going to be a second largest and third largest economy, healthcare has to expand to nook and corners of the country, right? I think vital requirements of healthcare demands are increasing, and if we have to give a universal coverage, there has to be a model of public-private partnership, because infrastructure can be developed only by government if you have to go to every corner of the country, right? That's the requirement, and regulatory framework also needs to be tailored for this essence. So I think I'm expecting a major investment in healthcare, and allocation should go up significantly from this year onwards.
Okay. In terms of incentives, Dr. Navneet Bali, in terms of GST, do you have any particular expectations on that front?
See, for long, this question of input credit for healthcare sector has been pending, and the demand, almost like every year. So I think if you really look at it, we will have to, we'll have to look at GST for healthcare in its entirety and make it a little bit more simplified for healthcare sector. Looking especially at the input credit part. In addition to that, if you really look at how government looks at healthcare, every place where we see a little bit of push where the healthcare cost goes up, it is ultimately passed to the patient. So if you're looking at a true benefit to the patient, ultimately more simplification of GST, giving input credit to GST, I think that should be something that the government can really look at.
Surely that is the case, Mr. Yadav, isn't it, Anurag? There is specific incentives you can be given, and also not just in terms of GST, but other tax breaks as well.
Yeah, actually, government should look at a long-term infrastructure financing support for healthcare players, especially in Tier 3 cities, Tier 2 and Tier 3 cities. If those can be worked out, I think that will be beneficial for the sector itself.
Right. In terms of affordable healthcare, in that sense, if I were to ask you, Dr. Navneet Bali, subsidies for health checkups, that kind of measures can also go a long way in terms of establishing medical cover for a large part of the population.
See, absolutely right, Krishnan. If you really look at many of the government schemes, and then I think we've done very well. Getting huge number of people who are poor and below poverty line up towards healthcare system, but still it is not very inclusive. If, as I said before, if we really need to make a huge amount of impact on healthcare on a long-term basis, preventive healthcare has to be a mainstream, push of the government. And I feel that one single health checkup per year for every Indian, and specifically for people who are just not covered under any scheme, will do a great amount of benefit. Look at the rural population of ours, women in villages, etc. The hemoglobin, I'm just taking one small thing. I mean, if you just look at that one small factor, if the government were to incentivize private sector, for example, that anybody could just walk into any private sector hospital and get one health checkup, for which of course the government pays for it, and you find that the women specifically in rural sector whose hemoglobins are less, and we push this up so they are out of anemic conditions. Look at the effect it will have to the next generation of the children. So I'm just talking about small steps, but in my viewpoint, one health checkup for every Indian, I think is a must towards achieving that preventive health checkup first step. And I think that can go a great way towards, our better healthcare for Indians.
Mr. Anurag Yadav, that is the case, isn't it? Extending medical cover for the maximum number of Indians, and more importantly, with the costs of medical expenses only rising astronomically, that ability to provide affordable healthcare is crucial.
Yes, you're right. In fact, government has done some steps. If you look at in previous term also, government has expanded. Again, health checks will come with all the infrastructure around, and again, infrastructure is physical infrastructure and people around running the infrastructures. So government has in fact done a very good expansion in terms of medical nursing colleges to ensure a smooth supplies of healthcare professionals. I think one is that. Secondly, if you're aware, tier 2, tier 3, especially in bigger, larger states, there's a very successful scheme, which is just as a pilot, not very old, 5 years old, maybe around that, VGF, Viability Gap Funding of healthcare projects. I think that is accessibility. When my co-panelist Navneet is saying health checks for everybody, I think we have to go in this direction, both things expanding, and then probably health check for every Indian should be a good testament as a first step towards providing a better healthcare care for every Indian. And I always believe we have to put care back in healthcare.
Putting the care back in healthcare. We're talking about allocation for the healthcare sector. It's about 3% of India's GDP right now, and much lesser as compared to countries like the US, UK, France, Germany, Japan, China, and South Korea. In that sense, do you think fundamentally something has to change when it comes to the overall allocation towards the healthcare sector?
I think we should expect it should go up by at least 0.5% to 1% up. Because if you see last 10 years, it's going up, but at a slow rate. Maybe I think if we have to, again, we are poised to be the largest economy in the world. We have to focus on this sector a lot.
Right. Dr. Navneet Bali, all these other countries I mentioned, the UK, the US, France, Germany, they all allocate anywhere between 7 to 17% for healthcare. We are stuck at 3%. So from everything from affordable healthcare to providing more emergency services, it is not going to happen if the allocation per se doesn't increase.
See, Krishnan, a country like ours with a huge amount of population, a very small number of people paying taxes, tax to GDP ratio being abysmally low. Sometimes this very, very easily available solution of increasing the healthcare allocation, just does not work. Maybe a little bit, as Anurag was saying, a little bit of, you can push it more, but there are so many more expenditures the government needs to make. So, there are solutions which are available in private public healthcare, as was being talked about, in getting private sector more and more involved into preventive health checkup, into public health, into primary healthcare. But of course, private healthcare has to be incentivized somehow. So the answer might lie somewhere in between, that you allocate a little bit more towards healthcare sector, get Indians to be more healthier, get preventive health checkup into our basic health checkup ecosystem. And one thing maybe if you ask me later would be towards cancer. I might talk about it if you ask me later, but I would love that, something needs to be done toward that at all, because it is right now staring us at us like a pandemic.
Right. Let's stick on that then, Dr. Navneet Bali. The allocation on the ability to deal with non-communicable diseases, NCDs in India, be it diabetes or cancer, that is going to be crucial, isn't it?
Yes, in fact, we should not take pride in this, but we are starting to become, world's capital in diabetes, then we are world's capital in cardiovascular diseases, then we are going to become the world's capital in cancer very soon. As I said, no pride in that. Also, the cancer is a very, very expensive treatment because the patient undergoes chemotherapy, surgeries in many cases, and radiation oncology. And the radiation oncology, the machinery is huge. The investment is almost, if you have to buy a machine, it costs almost like 20 to 30 crores per machine. And today, India lacks almost 750 or 800 linear accelerators, each costing around 20 crores. So, we need to look at these. It is simply easy to say, but oncology, and especially cancer, will have to be looked at very, very differently. How do we incentivize the private sector to buy these machines? Pay-per-use models, give them tax incentives, push them to put linear accelerator into tier 2, tier 3 cities. Because in my viewpoint, and also in addition to cancer, as you rightly said, diabetes, cardiovascular diseases, we are going for next 25 to 30 years. I think we are going to be pushing the spectrum up in these also. Somebody will have to put their head together into these very much importantly.
Anurag Yadav, I want your thoughts on this, to deal with, silent pandemics, if I may, like diabetes and cardiovascular disorders. There has to be a clear focus on them.
Yeah, I think again, as we were talking a few minutes back, most important is health checks, because as Indians, as a society, we are not aware. We are not very insignificant population in the country goes for health check. We only go to the healthcare facility when you are not well, when you are hit with the medicine, when you are hit with a disease. So I think preventing health check is very, very key, and awareness and accessibility across the nook and corner of the country is very, very important.
All right, let me ask something from the pharmaceutical industry perspective. There needs to be that much investment going into R&D, research and development, and the development of drugs in this country, and that is so that the pharma industry can continue to keep innovating and continue to keep bringing more health solutions to the market.
You wanted to answer the question? Yes. So the answer to that is absolutely yes. Pharma industry typically is hugely depending on research and development, and they take a massive amount of investment for many, many years. And as you saw in COVID, India was the pharmacy of the world. And so now we have to become the R&D platforms of the world, so that, for next, let's say 10 years, 20 years, 50 years from now, we have got all the brain in the country. We need huge amount of incentives for R&D if we were to become actually, a country which produces absolutely world-class drugs. Today, especially in these diseases like cancer, etc., a lot of innovations are going on across the world. We need to invert that pyramid, incentivize research and development in the country so that we are able to produce those cutting-edge technology, those drugs, which then become at the forefront of fighting these diseases.
Okay, let me shift the focus away from that, Mr. Anurag Yadav. In terms of building medical infrastructure, that is going to be an important part of the overall, India's move towards being health secure, if I may, as a country. So in that sense, what would you expect something like the budget to do in terms of developing medical infrastructure in the country?
So again, I think maybe just to taking on your point, which when we were talking about R&D, I think I wanted to add one point there, because look, India's research R&D sector is very, very strong, and we need to bank upon technologies like AI and Digi Health, which will reduce cost and increase patient outcomes. I think which is very, very key for us. In terms of infrastructure, I think maybe we have to add more medical colleges, more hospitals, more nursing colleges, because that's a need of the hour. We need to make that foundation very strong, and then the infrastructure can grow from there. That's my view on that.
Okay, medical infrastructure needs to go from there. But as they set up this infrastructure, Dr. Navneet Bali, what will need to happen is being able to staff this medical infrastructure with the skilled workforce, and then that becomes the next challenge.
Let me tell you, India will become the factory for the world as far as healthcare, professionals are concerned. Government has already started taking some steps, It will be doctors, nurses, technicians, paramedics, which will not only take care of our own deficiency and inadequacies as it stands today, but for the entire world. Because as we saw in COVID, I mean, this was something that was majorly felt all across the healthcare system of the world. So I think a huge amount of attention has to go towards developing this very important, and we've got an opportunity today in India that if we are able to do so, imagine, look at the opportunities. You become the pharmacy of the world, you become the R&D capital of the world, you become a center point and focus of the world as far as producing quality healthcare technicians, paramedics, and healthcare professionals are concerned. So the opportunity in front of us is staring on our face. It is how the government policies are going to shape, and that's going to be very important.
Anurag Yadav, one is getting a skilled workforce and the other is to be able to reskill that workforce, the existent workforce, to keep up with the changes in technology as far as healthcare is concerned.
So in fact, just to add here, like I think I've been in this industry for the last more than 25 years. And good part is there's a continuous medical education, which is part and part of this industry itself. So like we got robots few years back. So technology is changing very fast. And I can say with very proud that India, the technology and the pace of change of technology, we are ahead, not even ahead, but we are at the best healthcare system across the world in terms of technology, skill, and delivery, and patient outcomes.
Okay, I'm going to ask Dr. Navneet Bali, simple, what do you think should be the top 3 things that Budget 2024 needs to do for the healthcare space, from a long-term perspective?
I think the most important thing is to focus on primary healthcare, preventive healthcare, making private sector also involved into the primary healthcare and the preventive healthcare. Second thing, it would be, we need to get out of metros and move towards tier 2, tier 3 cities and hugely incentivize private healthcare to set up institutions. And for me, the third would be to look at these cutting edge technologies to be developed inside India. At the same time, focus on the pandemics, the silent pandemics, as you rightly call them, for the future, especially cancer. And that would be one of my key, areas of concern.
Anurag, your top 3 wish list as far as Budget 2024 is concerned.
I think my sense is I think government should continue to focus to open more medical colleges, nursing colleges across the country. I think one will be that. Secondly, I think government should be enhancing and bringing more reforms in insurance sector, because penetration insurance is there, but I think it has a lot of more way to go, because that will make healthcare accessible to more pyramid of our country. And third, I'm expecting government to do some simplifications of regulatory processes and policy stability, because today, if you want to set up a hospital, just to give you a perspective, you need 75 to 80 clearances when you're setting a hospital for the first time. And if you're running a hospital, you need 35 to 40 clearances year after year. I think this is huge. I think we need to cut down these regulatory requirements.
All right, we will leave it at that. Anurag Yadav, CEO of Gleneagles Healthcare, and Dr. Navneet Bali, CEO of Clearmedi Healthcare. Thank you so much, both of you gentlemen, for taking time out to be with us here in this pre-budget special here on News 9 Live. We will continue with our pre-budget programming all the way up to the presentation of India's Budget 2024 on the 23rd of July. But for now, we've completely run out of time here on this show. Thank you so much for watching. This is Krishnakumar signing off.